for me.
Okay. Hi, good morning, ladies and gentlemen. This is Anna Southern here with RVA Connected at My King Biz 106.1 ESPN Richmond. Heard on FM, but we don't talk about sports because, as you know, your girl doesn't know anything about sports. But I do have one of my sponsors here who I'm super excited to introduce to you guys, so you guys can learn a little bit more about what she does and why she loves doing what she does. So who do we have? We have Dr. Erin Buikema. I did it.
You did.
I did it. Everybody screws up my name, and I'm so cognizant of it that, of course, I'm going to go and screw up her name. But anyway, okay, so tell everybody who you are.
Hello, I am Dr. Erin Dexter Buikema. Sometimes I go by my maiden name, Dexter, a little easier to pronounce. But I own and operate Capital Home Veterinary Care, and we're a mobile house call veterinary practice that we practice about 10-mile radius around Richmond.
I love that.
Yeah.
So I've seen you. Yeah, I've seen your trucks,
Yep.
right? Driving
Yep.
down or your vans, I guess, trucks, vans, same thing. So when did you start your business?
2007.
Oh, wow.
I know.
Okay.
I started off in a Jeep and a toolbox in the back. Yep. And I bought a toolbox from Lowe's, and all the drawers had all of my medical equipment and a little cooler. It was just
love
me.
that.
Yeah.
That's amazing. So now you are a practice of how many vets?
Three
vets.
Yep.
Okay.
3 veterinarians, 3 mobile clinics. We just actually bought another one. It's in Las Vegas right now, getting ready to move.
Oh, okay.
Yeah.
I was like, oh, you're expanding your practice
Yes,
in Las
no.
Vegas?
It wouldn't be there. I wouldn't get much work done.
No, probably not. You're like, hey,
No.
honey, I got to go to Vegas today.
But we're adding on another. So yeah.
That's amazing. Okay. So you said a 10-mile radius. So I'm geographically challenged. So where does that put you?
So the counties, we're obviously all of Henrico, so Richmond. Okay. We do go a little bit into Ashland, a little bit into Mechanicsville.
Okay.
About the right half of Goochland, Powhatan County, and then Chesterfield is a big one.
Awesome.
Mm-hmm.
Okay, perfect.
Yep.
And you're located in Chesterfield, right? I've been to your office, but again, geographically
like the south
challenged.
side. It's technically like North Chesterfield, but yeah.
Gotcha.
Yeah.
Okay.
Pretty central. For us to get wherever we need to be.
Okay. Mm-hmm. So you started. So obviously, there's not to compare, but there's other vet services. So what's the benefit of having like a mobile vet?
Oh my gosh, there's so many. Probably the number one is patient care.
Okay.
Like this model, I only see about 8 patients a day. So I can be awesome 8 times a day. When I worked in brick and mortar, 50. People get tired. You get tired. You're in that 3 o'clock slot, and you're like, okay, I love doing this, but it's every day a lot. So we all do amazing jobs with 8 patients a day from start to finish. And we have the time to take when we have anxious patients, we have anxious owners, situations come up, maybe it's a case that is a little bit more involved than we thought. We're just never hurried. And that's really, I think that really, sets it apart for sure. Mm-hmm.
Do you find that dogs, because my dog is very anxious. Mm-hmm. I mean, I think she's a-hole, but there's that aside, but she does get
out that way sometimes. It's scary.
She is very anxious. And so do you have pet owners who say that my dog is less anxious when you come to them and they're in their own space and stuff like that? Do they act differently?
They do. And a lot of it is the wind up, right? Like, so a typical brick and mortar appointment, right? Mm-hmm. You're going to go in, you have a car ride. So especially if you're kitty friends, not big fans, but a lot of dogs don't like it. So you have the car ride, then you have the reception area. You got to sit there. There's dogs and, running around, barking, whatever. Yeah. Then you have the exam room. Then you have the assistant come in. So that is a lot of process to go through before the doctor even puts hands on the pet. Yeah. Right. So we don't have that. We gather so much information for the doctor before we even get there. Understands the case. How many times you go into your doctor and you're like, you tell 5 people the same story. You know what I mean? So like all of that is there for the doctor. We text you when we're on their way, when we're on our way.
Awesome.
So you can be doing whatever you're doing until, okay, oh, they're coming in 5 minutes. You know, you get your pet ready. We take care of, we're very efficient. We try to reduce the amount of contact time so the pet can be back at home, sleeping in the sun. So that is where I think the biggest difference comes in, is just the external stressors that they have to have in the traditional practice, where we get to remove a lot of those fearful things just in the nature of the mobile part.
I love that. So when you bring them, when you go to the house, do you stay in the house or do you bring them out to the mobile?
Either. Sometimes, you know, we prefer doing them in the mobile clinic because
you have
everything is right there.
Yes, you don't have to.
We do have certain, and we also, you know, head out for just little things like a booster vaccine. We just pop in the house and get that done. You know, they don't even know what happened. Like, they're like, oh, okay, here's a treat, bye. And then also, like we do a lot of quality of life, you know, talking about hospice care. And then of course the other one, which is near and dear to my heart, is the in-home pet euthanasia. And those are usually done in the home, wherever the owner feels most comfortable, the pet is most comfortable. So
what's the span of services that you offer? Because I'm sure that's a lot and people don't even think about. Because I'm thinking about this as like basically concierge services for your pet, which is, I think, fantastic.
Yes, it's very tailored medicine. Like, we're very tailored to what pet needs. Certainly wellness care. Anything, laboratory services, full pharmacy, sick pet care. Minimal surgeries. I used to do all surgeries in the van. I just like it better in a brick and mortar facility. I think it's, you know, it takes a long time. Just like if you even go in for a short procedure, it's beginning to end. So that makes it a little more difficult with our model, but we have great relationships with a ton of brick and mortars that, you know, they'll take your pet for the surgery and then, you know, they're right back home. So surgery is less of what we do, but basically pretty much everything else. We carry ultrasounds in every van. And, so that is a real help for diagnostics. And then we have a therapeutic laser. We do a lot of geriatric pet care, right? Because our pets are living longer now.
They are.
And our big dogs are living longer and they do not like to travel. So we bring, you know, we have a lot of tools in our toolbox to really increase that quality of life for as long as we can do that. And the therapeutic laser has been very helpful for inflammation and pain.
So I'm curious because I think that it's fantastic and but there's a lot of people who are skeptical around it. Like I had thought about it for my pet before she passed. Because I do laser on when I have, you know, inflammation in my joints and stuff like that.
I use it on me.
Well, so I'm going to tell you this story. So when I was a good friend of mine, her dad is a vet. And when I was pregnant with my daughter, I went in and he actually did an ultrasound on my belly.
Fun.
You know, he's like, just get up on the table. And I was like, what? I mean, okay, that's weird. But he did an ultrasound on my belly when I was pregnant in the vet office. But so I just remembered that. But how is the skepticism around the ultrasound or the laser? Is there? I'm just curious.
It's used in a lot of human chiropractic medicine because, of course, you're dealing with chronic inflammation, chronic pain. The science behind it is really, really cool. And
it is.
Yeah, absolutely. And penetrating tissue and reducing inflammation. And the really weird thing is to watch wound healing. Like we'll do it on wounds. And it quickly, because it reduces inflammation, the wounds close much faster.
Interesting.
Yeah, you gotta do it every 24 to 48 hours. But I love it mostly, and especially in our patient group is the geriatric pets and like their hips and their knees and things. And I mean, we use traditional therapy as well. That really does. It's a nice additive. For that.
I love that. And I do. So I go to the chiropractor every 2 weeks because that's how I can do the things that I do, right? Like,
I'll go there.
Right? It is. It's for me. It's maintenance, right? Everybody's like, "Oh, that must be nice." I'm like, no. It's just for me. It's just strictly maintenance, to be able to function and do the things that I need to do on a daily basis.
For sure.
So, what do you think has been your most unusual case that you've had?
Unusual case. Gosh, there's so many.
I mean, you've been in practice for like 19 years, so it's right. That's math. 19 years.
Yeah. Gosh, you're putting me on the spot. At one time, we diagnosed a very rare parasite that had been making the pet sick for a long time, and they had been to a couple of referral institutions too.
Oh, wow.
Yeah. And it was, sometimes the simplest tests that we do bring up, and I was like, well, let's just run one more and just see. And then it'd come up and I couldn't even pronounce it if I wanted to. I'm like, I have no idea what that is. And I didn't learn about it in vet school. So
it was that rare.
Yeah. Yeah. Thankfully
Gotcha.
our dewormers worked on it, but that was a crazy one. And it went by, we thought it was some crazy internal medicine, gastrointestinal case. We're looking for masses. We're looking for all sorts of things. They've gone through quite a spectrum of care. Yeah. But all I need is some meds. So.
Some pooping meds.
Yeah, pooping meds.
Pooping meds to get them straight.
We're all good.
Oh, back. So what is your advice for people who are pet owners? So, whether like regular maintenance, not maintenance, because they're not vehicles. Preventative, right? So like going to get your dog checked every 6 months for them to have a wellness check and stuff like that. Like, what are some of the things that maybe people miss?
Yeah.
Because your dogs can't tell you, right?
Yeah. I think a big one, so we do annual exams up to about 5 or 6 years of age.
Okay.
And then we want every 6 months is ideal. And the other thing that we do, and especially with my business, is we are very lab centric. And I think humans are starting to do that, be a little bit better about that too.
Yeah.
And because dogs and cats don't live as long as we do, you go a couple of years without looking at internal organ function, you could have caught something a long time ago that was easily treatable, and instead of, doing the lab work after the pet's already sick, we do this preventatively. And, we have packages with a reference lab that make them relatively affordable too. And I would say one of the,
we're still going.
Okay. Just one of the biggest,
okay, I'll keep going.
One of the biggest things for our preventative maintenance care and what we recommend is we catch this stuff so much earlier because of our recommendations. And it's awesome. Like, we get to catch abnormalities before you even see it clinically. Because you're right. A pet can't say, I've been feeling really tired.
Right. Yeah.
They can still get up and go for their walk. You wouldn't know until now you've hit a critical mass point where, homeostasis isn't happening anymore in the body. And now a lot of other body systems are trying to, to circle around it, and you have lots more to treat. So I am always fascinated how much we catch before. And I think that we forget about that because it is, they're fine. They're eating, they're drinking, they're doing their thing, So just getting that biochemical baseline, I think, is so important, especially once they turn like 5 or 6.
Okay. So you do annual up until about 5 or 6, and then every 6 months.
Yeah. We like to look at the pet every 6 months. Okay. The nice thing about virtual medicine now, just like humans, after COVID, a lot of our rules and regulations we're a little more relieved. And so sometimes the 6-month exams, like, we can even do them virtually, which is really nice for anxious pets. It really helps them. Sometimes we'll send a licensed technician out to get blood work or something like that. But the vet visit itself can be really minimized. So that's kind of fun. Oh,
I love that. I love that you guys can do that as well too. Again, so just going back to really make it like patient centric, right? 100%. And just make it easy for them as much as you possibly can. I love that.
And that's why I got into the mobile world after brick and mortar. And I said about the, tons of patients. I mean, I feel like veterinary medicine is following human medicine. It's the corporatization of medicine. And, you never see the same providers. You don't, and it's really, that care is reduced. And it's not because veterinarians or doctors are not as good as they used to be.
Right.
It's the volume.
Right.
And the corporatization of money first. Yeah. And I think that really starts to degrade the patient care part of it, which is really important to me because I've seen the reduction of that care through when I graduated in the early 2000s and how my mentors practiced medicine in the 90s and 80s. And to see that reduce, I feel like this is the last part that I can keep.
Oh, I love that. So how many mobile vets are there? And do you know, industry wide, across the US and Canada? Because I feel like it's not
numbers. It's a more typical model for a one vet practice. And the reason why is because of burnout and the corporatization of veterinary medicine and being told that you have to sell. That's not why we got into vet med.
Right. Yeah.
So I think veterinarians look at it as a great quality of life, and they can offer great care. So I think that's a more typical business model is just the the single doc and just enjoying their day,
Yeah.
which I loved. But I also love, one of the not so great things about that is it's hard to cover a big area.
Right.
So now when we grow, we're not growing to like amass patients, we're growing for availability.
Right.
So we always have a doc above the river. We
Gotcha.
always have a doc, below the river, so we can get to you.
Yeah.
Which is important.
Yeah. Because it like regular vet visits, right? Like those, again, easily scheduled. Yes, I have to see, shoo in the next 6 months. We'll go ahead and get that scheduled out. But when something's happening, right? Hey, my dog has had diarrhea for the past 3 days and I have no idea. You need to have that availability for the pet to be able to go
100%.
and see.
You can't be like, I can see you next Tuesday.
Correct.
That's not fair.
Yes, exactly. By then it'll either have resolved itself or gotten much worse as well too.
True.
So I love that. I love that you have the availability to be able to take those
and it takes a while to grow a business to the point where we can do that, but we are at a point, and we have been for a couple of years, and that's the whole point of another vehicle, is to make sure that we're available to them, because it doesn't always happen on a scheduled basis.
No, it doesn't.
No.
Imagine that. Life never happens on a schedule. I'd really love for this to happen next Tuesday at 2 p.m.
Yeah, because I have a free day.
Right.
If you have diarrhea that day, that'd be great.
Not any other day. It's like when the fire alarm decides to go off at 2 o'clock in the morning.
Right. And you have an interview or something the next day.
Exactly.
Or
you have to fly out whatever.
100%.
I think that's insane. So you have, so it's you and 3 other vets. Correct?
2 other vets.
Two
So
other
it's me
vets.
and 2 others.
Okay.
And then we have 3 licensed technicians.
Okay.
Yeah, which is great, because that's a big availability. Again, with the virtual medicine, we can do things like that. And also, just simple things that need to, not too complex things that that they can do, just redraw of blood or, some injections, things like that. It just, again, increases availability because everybody's so busy. But we're really lucky in the mobile world. I feel like clients trust us so much. Like, we have garage codes. We've got keys under the 3rd rock to the left. You know what I mean?
Just go in and do whatever you need to do.
And they'll be on the Ring camera and be like, okay, the check's on the, on the counter, and it's a really cool, it is because it's the trust, right? And I think that's what has been lost, not just in veterinary medicine, but human medicine too.
Oh, 100%.
And I feel that as a patient. So,
yeah, I love that. Okay, so what's next? I mean, you have another van coming, right? Mm-hmm. So to increase availability, but what's after that? What do you want to?
So I've been toying around with a stationary surgical facility, right? Because that would kind of round it out.
Okay.
And then I would say we also do something for the community once a month. We do wellness clinics.
Oh, okay.
Like in Southern States locations. It's the second Saturday of the month. Excuse me.
Okay.
And so I wouldn't mind.
Southern States, is that
like the co-op? Like, it's a feed store.
Oh, okay. I was like, I've heard of that, but I don't know what,
Yeah, and we do them in our office too every morning. But we try to be available, get wellness services available to the community on a little bit. It's a little bit more on a budget. Yeah, and that's me too, because it's all pets need care.
Yeah.
And
do we put those events in our calendar?
No, we just host them.
Okay.
Yeah. But
if you want to, we should.
Yeah.
I would love to have that, and just that go out to the community as well too. So we can put that in the calendar of events.
It helps people that for a package price they can get their wellness services done.
Yeah.
And make sure our community is protected.
Right.
Veterinarians are not always just about pets. It's about keeping our human population safe from rabies and parasites and things like that. Yeah. And that's our oath too.
Yeah.
So
I love that.
Yeah.
Do you guys do what's it called?
Yeah, spays and neuters.
Neuter.
There are so many spay neuter places. I think we have 8 now in
Oh,
Richmond.
wow.
Yeah.
Okay.
So those docs, that's what they do all day long. I did it a couple shifts. When I used to be a horse vet. So when I changed over to small animal, I'm like, I need to brush up on my surgical skills, my little, because the instruments are this big for a cat, this big for a horse. So I've got to acclimate. Yeah. And I would do 40 a day. And talk about back problems.
Oh my!
At the end of the day, I would sit and do cat neuters on the table. I'm I was probably 35. I felt like I was 80. And
that's insane.
Yeah, but they're so good at them that the incisions are teeny and they're done in 10 minutes. It was fun. It was a good thing to do. I didn't really want to do that forever, but a lot of people love it.
That's
So
awesome.
no, we don't. We usually we send our surgeries to our colleagues.
Yeah, I love that.
Yeah.
So you went from being a horse vet to small animals. What made you do the switch?
Well, when I was working on large animals in Charlottesville,
Okay.
I would cross paths with a veterinarian that worked out of her Volvo. And I'm like, that's really interesting, but I'm working on horses, whatever.
Right.
And then as time went on, we all make compromises, and having kids. I mean, being an equine or a farm animal veterinarian, you are, in small animal, we have emergency hospitals, right?
Right.
So your practice would close around 6 or so.
Okay.
But in large animal, it's 24/7.
Oh.
So, as a lot of us have to kind of make some compromises and having kids and all that kind of stuff. So I thought, you know what, let me give it a go.
Okay.
Yeah. And I enjoyed brick and mortar practice, but I really I miss the patient care part.
Gotcha.
And that's why I moved over to the mobile part, because the relationships I had with like the horse owners and things and their patients, like I saw them where they live, right? I mean, what better place to
figure
address,
out what's going on.
Yeah, husbandry, and maybe, help with mobility or what have you. And so I just kind of extrapolated all that to small animals.
I love that.
Yeah.
So how long did you do that for?
About 3 or 4 years.
Okay.
Yeah.
Okay.
Yeah. I did a equine surgical internship my first year out in Florida.
Wow.
Yeah.
Okay.
It was fun. I love working with my hands. And
Yeah.
I like fixing things.
Right. Yeah. When your daughters ride.
Yes.
Right.
Yes,
as well
they do.
too. So you're
Yeah.
still in that world.
I do.
Still involved.
I do.
Do you ride as well too?
I don't anymore. No.
Oh, okay.
I don't ski. I don't do it. I feel like everywhere I look, I'm just gonna like bust a knee.
Right.
So I'm like,
ouch, that hurts.
I'm good. I'm gonna sit here and read my book, and you go have fun.
You go do
Yeah.
the things. You
Yeah.
go do the things.
Yeah.
I love horses. So when I lived in Virginia Beach, I went to Catholic High. We were required to do volunteer hours,
Mhm.
which I think every high school should do.
I agree.
Not just certain programs. Every high school
Give
kids
back.
should learn how to give back
Mhm.
before they graduate. But that's neither here nor there. We can talk about that later.
Mhm.
But I did my my volunteer hours with Equikids.
Oh yeah.
And
Yeah.
so they're therapeutic riding programs for people who have who are on the spectrum or have PTSD and things of that nature. And I love horses.
Mhm.
They also terrify me.
Yeah.
Because they're massive, and
Yeah.
it's not like you can be
And
like,
they're flight animals. Like not only are they big, they like to run.
right, they
Yeah.
do, yes, and you spook
Away.
them, and yes,
And they're scared.
yes,
Yeah.
exactly, and so and they can feel,
Yeah.
they can feel exactly how you're feeling,
Yes.
and so
from afar away.
100%. I rode. A friend of mine also had horses, and I rode one, and she gave me. I don't know why she gave me this horse. This horse was blind in one eye,
Mhm.
like the left eye, but she was a very good, not a lead horse, but a follow horse. Like she would just follow the horse in front of her. Well, she started to trot a little bit. And so my horse was like, okay, well, I'm going to start trotting. Well, again, she couldn't see. And I don't know how to drive a horse, right? Like absolutely zero guidance from me. And so I ended up on the other side of a fence because I don't know how to lead a horse.
Fair.
And, the poor horse was like, well, you're a dummy. So
I'm taking
apparently I'm just going this
taking the
way.
reins.
Right, exactly. Because you don't know how to.
The grass
Yes.
looks better over here.
Right, exactly. But yeah, so I love that. I didn't realize that you had done
Mhm.
equine.
It's fun. I still dabble in it.
Yeah.
And I enjoy it.
So how many
when I
people
was-
ask you because they know that you're a vet? They're like, hey, so this has been happening with, like, how often does that happen? Whether even equine, like if you're out on the, on the ring and people ask you that, or even like just out and about.
All the
Your
time.
neighbors.
All
I
the
can
time.
imagine. Hey, Erin.
We actually have a funny thing. So when we were on our honeymoon,
Okay.
and it was a very small little resort. It was really cute, and it was St. Lucia. And this lovely couple was talking to my husband. My husband was chatting with them and told them that I was a veterinarian. And then all of a sudden, it was it's hilarious. Like people love to tell you about like their last 15 pets and like every medical problem. What do you think about this? Which is awesome, but sometimes when you're on vacation, it still works sometimes.
Right. Yes.
Right? So after the honeymoon, I'm like, so you are never allowed to tell someone that I'm a veterinarian ever. Like pick any profession. When I tell that story, people of other professions like teachers. I guess that happens to teachers too, because you have kids and you want to know, and it's the same thing. You have a pet and you're like, oh, I can get a second opinion. People aren't being rude about it.
Right.
They're just curious, and then it's and it's an easy conversation. But yes, I do. I'm like,
Right.
Cannot tell anyone. So yes,
you're like
I really don't mind helping, by the
Right.
way. But sometimes when I'm just laying out with a cocktail or something, I don't want to talk about poodles.
Right.
I want to read my book and
Right,
or
exactly.
trash a magazine or something.
Right, exactly.
Yeah.
But I think about that, like, like I'm sure a financial advisor, as soon as somebody finds out, like they want to know, like, is this stock really good?
Yeah.
So it happens, right? That's just human nature.
Easy conversation, but
exactly,
sometimes.
yes. And you're just like, I just want to drink my Mai Tai.
Exactly.
Read my smut
and not
novel.
think about anything. I'm recharging. Yeah.
Right, exactly.
I'm not
Allow me
working
to
on medicine
recharge.
right now.
Yes.
Yeah.
So he's learned?
He has absolutely learned.
Okay.
Absolutely.
I love that.
Yeah, didn't take long.
Okay. So as we sign off here, what is something that you would like to share with everybody here? Like what's, whether it's a piece of advice or, I don't know, just something you'd like to sign off with.
Like about patient care
or business or whatever you'd like to share.
Take good care of your pets. Yeah. And ask questions. Right. Maybe not with my Mai Tai in my hand, but like, ask the questions and find a practice that listens to you. Same thing as human medicine.
Yeah.
You've got to find somebody that listens and sees, and they can be such a huge part of your life, even if it's for a short time of your life.
Yeah.
But they deserve to be cared for.
Yeah, agreed. Yeah. I think asking the questions is important because we don't. So do you recommend people like actually write them down? Because I think about like every time like I go to the doctor, I'm like, oh, this is when the next time I go to the doctor, I need to ask about this. And then you go into the doctor and they're like, hey, so what's going on? And you're like, I'm fine.
I'm good.
Because today, whatever it was is no longer bothering me. So
and we do, and I kind of touched on this with our practice, like we do a lot of information gathering before the visit, because I don't want the kitty to be sitting there while we're yammering on about 4 years ago and you're looking for your records in your phone.
Right, yeah.
So we gather all of that and we ask that question. What are some of the things that you want to ask the doctor today? Because it does get lost. And if the owner is stressed or something's not going right or for them that day, they forget. So that way we know to address all of those things.
I love that.
Yeah. So that informational gathering is really important.
Yeah.
And I do think that gets lost when you have so many patients. Again, I keep going back to human medicine, but when I'm a patient now, I'm like, I've said this to 3 people now. Like, how is that not in my record? You know what I mean? And that having a complete medical record allows the professional, wherever you are, whatever industry you are, to get an appropriate picture, an expansive picture of this patient and where to go. Right. And you might make better decisions because you are so well informed.
Yeah. And it'll help you link things together that maybe us as not being in that profession, like we would never connect that. We would never like, oh, the fact that they, vomited 4 days ago and now whatever. And you're like, oh, this is, that type of thing.
100%.
Yeah. So I love that. Yeah, I love that. And it being all in one place for all the people to see.
And for each time.
Yes. I love that.
Yeah.
Okay. So how can they reach you? Phone number and website.
Sure. So it's capitalhomevetcare.com. Next time I open a business, it will be like one word.
Right.
Like at home vet.
Right. Super short.
Really short. My email address is long, so it's capitalhomevetcare.com. We have a pretty extensive website and a usable website, lots of forums in there, things like that, that you can request appointments, schedule online now, which is kind of fun. And it's 804-432-2534. And you can email, you can text, you can call.
Love it. But their website is very comprehensive as well too. You can do everything. Like you can order
prices on there.
Yes, yeah.
There's everything that we do. I really tried to
book appointments.
Yep.
And I think you can even order meds on there, right? Like if there's meds.
Yeah, we have an extensive pharmacy that comes out to you, but also we have an online pharmacy that is directly through our distributors. So that the medications are safe and appropriate.
I love that.
So that makes it easy. We're trying to reduce barriers to care.
I love that.
Yeah.
I love what you guys are doing. Awesome. Well, thank you again for being
you
here. This was a lot of fun.
It was fun.
Good. All right, guys. So make sure that you tune in next week. I should probably know who it is, but that's okay. Always on Tuesday mornings at 10 a.m. And as always, stay fluid, my friends. I'm always cheering for you. Have an amazing day. Bye.